The aim really is to give you the most up-to-date data and feeling and judgments on what's going on in stone disease. We're very pleased to have three outstanding people coming to present to you today. So we've got Ollie Wiseman, who's going to talk about the scopes, very topical at the moment, fibre versus video, and of course disposable versus reusable. Ben Gray's going to give us the complete line-up of all stone consumables, so that'll take him about an hour and a half, I suspect. And then Matt's going to talk about, here we go again, does size matter? But this time it's not for prostate surgery, but for PCNL.
So what about narrowband imaging? Well, this can improve visibility of the capillaries, the veins, and the supple tissue in the kidney, which can be useful when you're trying to detect upper tract cancer. And you get essentially two discrete bands of light, which can help, as you can see in the picture here, to show you subtle changes within the urothelium. And Olivia Traxier showed that it helps to improve tumour detection by around 20%, and will also allow you clearer definition of tumour limits. That's how I think digital versus fibre optic weighs up. There are certainly pros and cons on both sides. There's smaller calibre with the fibre optic, and they're cheaper, but you may have less operative time with your digital scopes, and that's probably due to the better vision that you get. The pros and cons of single versus reusable. Obviously a single-use scope you can only use once. Reusable scopes you use many times, and they have a higher initial cost. And then also the number of ureteroscopies you perform per year. Different companies have different cost models which include different factors. This is the one from Olympus. And you can look at the annual cost of Flexi URS ownership. And you'll see that if you enter into a service care plan and you do 100 cases per year, your cost is going to be about £44,000 compared to if you go to a single-use scope where it's going to be around £70,000.
So I'm going to focus a little bit on 5 products. So the standard things like guide wires, access sheaths, baskets, stents. So this is one of the hybrid wires available. This is the Ultra Track. It's got a flexible atraumatic tip, which is hydrophilic. And the slight new feature with the Olympus version is the thumb wheel, so it aids the access, because they're so slippery at times. Getting them even into the scope can be difficult. Atraumatic navigation is the key thing. Those impacted stones, you may not realise how impacted it is until you get up there. And obviously a lot of the time we're passing wires just under the fluoroscopy, and you need that reassurance that you'll get past something. The beauty of an access sheath really is speed of removing fragments, and I've sort of, again, we talked about dusting and fragmentation this morning. I seem to have gone a little bit, I was very much went towards dusting, and I seem to be creeping back towards fragmentation again now. Possibly it's my patience. Urologists are meant to be very patient, but sometimes you just want to be in and out and getting those fragments out quicker, and an access sheath is the way forward.
Now we're kind of in a new era really of stone management, in that flexible ureteroscopy wants to take on bigger and bigger stones, while at the same time PCNL seems to want to take on smaller and smaller stones. And while there was always a little bit of overlap before, in that maybe 15mm stones, maybe a bit less than that in the lower pole, would be Flexi URS or PCNL cutoff, now it just seems like it's a lot more, a huge range where people can say, oh, that's definitely URS, that's definitely PCNL in my hands. So does size matter? Well, I think it probably does, doesn't it? And if all of you had a stone, and you could be promised that you'd be stone free after one of these 2 procedures, so you can have an 11 or 13 French Ultra Mini or a 30 French Amplat sheath, I'm sure you'd all choose to have the smaller sheath size. But you might not choose that if the trade-off was the risk of becoming stone free was significantly lower. And if you look at this as the rough stone size that you might say is the maximum you would take on, I know you could argue Mini could be higher and Ultra Mini maybe up to 3 and Micro up to 15mm. But if you take those as roughly what you might use, and flexible ureteroscopy wants to say we can do 2 centimetres, maybe we can do 3 centimetres, but actually is miniaturised PCNL really competing with PCNL at all? Or in fact, is it really now competing with flexible ureteroscopy? I've been using this for some of the 26 French PCNLs I do, which I think does actually have some advantages, which is why I'm just mentioning it. Well, I think one of the big advantages is that it's plug and play. So it's a bit like plugging a mouse into your computer. You just plug it in and it works. So this is very simple, and you simply connect the suction onto here, and then you're away. So actually it can be set up in about 1 minute by anybody. I found that very good. This is the Olympus pictures, but just to show it does actually work in a slightly different way. I found it more effective than what I currently do, and I think that's probably because it doesn't work differently. If you have a standard ultrasonic mechanism there, this works by having some ballistic energy as well, but it's different from a lithoclast, because whereas that is just either between 1 and say 15 hertz, this works at 300 hertz, so it's very little excursion of the probe. And as I say, I found it to be effective, and they would suggest that in their graphs.
Thank you to Danielle and the Olympus team for sponsoring this.